Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello.
Hi, how are you?
Good morning. How are you doing?
Good morning. Good morning. Doing well. And yourself?
Good. It's Monday morning, but I'm on leave, so I'm happy about that.
Yeah. President's Day. Good.
Yes. So let me start by thanking you. Thank you. I'm so grateful that you took the time out today on your day off, and you're here with me to talk all about the thing that we both love so much. So thank you so much for taking the time out. And
Yeah.
if I'm a little fangirling, please forgive me for that.
No, no, I appreciate you having me. And even earlier when we had this conversation, I don't know if it was a month or so ago, and I'm honored that you even asked me to be here. So thank you.
Yeah, you're welcome. Let's dive in. So let me start by asking, what is health and fitness according to you?
Yeah, I like to look at it from a bigger perspective in the sense that at the end of the day, we get one body, right?
Yeah.
We have to take care of it. And I don't want to say you take it for granted when you're younger, right? You don't think about these things, but as you continue to grow and get older, you try to be more conscious that little aches and pains that you feel in the morning, stiffness, and you're like, wow, I need to make sure that we're doing the right things, and that's eating the right things, exercising,
Yeah.
and also going for routine maintenance checks to make sure that we continue to stay strong and move forward in life.
Right. How did you start? What was the reason or the idea behind just focusing on ACL?
Um, well, a little bit of background. I got into physical therapy for sports. I played soccer all my life in college, and I was hurt a lot. So it opened the field of physical therapy to me. And
Right.
after I graduated, I did a sports residency at the University of Delaware. And Delaware is very, very well known for ACL care and research. So during my time there, I would see a ton of ACL clients from start to finish. We would see them in the OR following the surgeon that we were with, and then we would get them that first day of rehab and then get them all the way back to sport. So it really opened the doors for me from that regard with how to properly treat. And I just kind of fell in love with it, just the whole spectrum. So, and that's what led me here.
You just wanted to focus ACL from the start, or you had sports as a whole field open to your career?
Well, it was definitely started with sports, and one of the reasons that I sought out Delaware is because of the leaders there in ACL research. And once I immersed myself with that, I just fell in love with this clientele, this group of clientele.
Right. You see a lot of soccer players, or it's more spread out?
More spread out. Earlier in my career, I would see a lot of youth, high school, college, even some professional level type athletes in various sports. What we do now at the ACL Academy is people people are very, very active throughout their lifespan. So believe it or not, we see a lot of people in their 30s, their 40s. My oldest ACL is a 64-year-old. We're seeing this injury happen later in people's lives, and because it's a good thing in the sense that people are staying very, very active for longer and longer, which is cool.
Right. It's so hard to imagine such a small ligament, so tiny ligament behind, and it causes so many problems.
Yeah, it's really wild when you think about it because when you don't know anything about the ACL or the knee or you don't have any background in this particularly, like you said, it's one ligament out of four, and you're like, wow, I should be able to stabilize, but it's a very powerful ligament and does a lot for ourselves, especially with rotating, twisting, turning, and things like that.
Right. Well, talking about ACL rehab, what is like your protocol or your program while you're seeing an ACL patient?
Well, there's a couple things that go into it. When I talk to somebody who just got injured, for example, I think you have to have a more personalized approach in a sense that there's a lot of factors in decision making on which direction to go. So you really want to find out about them, not only how old they are, what sports they play, what's the volume of sports they play, and what really they're looking to get back to. And then based on that, that can help you make some decisions. And a lot of times what I do recommend for people, especially for those that are not necessarily getting back to let's say a high school sport, and they want to get back in the next year. For somebody who's, let's say, 25, who's a skier, spends 30 days on the mountain every year, these are things that I would say, hey, let's do some rehab first. Let's make the knee as strong as possible. Let's take care of the swelling. Let's get your motion back. And then we can make a decision based on that and how you're responding to that. So I think it's important to educate early on and let people know that it's not a black and white decision, that we need to take a step back. Let's learn a little bit more about you, about your case, about what your goals are in your life and the recovery process, and then make a decision on what is the best route for you at that time.
Right. I was talking to actually one of the therapists on the live, and they were telling me how the recovery period is going on reducing. Like after a surgery, after an ACL surgery, usually you're expected to be immobile for some period of time just to help heal the surgery. But now the period of rehab is the doctors are expecting you to start rehab so quick. That was not done before.
Yeah, I think what people should understand, and they don't because it's not talked about, the graft, believe it or not, is the strongest on the OR table when they first put it in. And then it goes through a transformation process. It gets weaker around anywhere from the 8 to 12 week mark. So these are the things that, like, I want people moving right away. So that doesn't mean necessarily they need to be standing and walking, but there are certain things that they need to work on, like laying the foundation, which is swelling control and getting that extension back. So we try to be pretty aggressive day one. And if I can talk to somebody prior to their surgery and educate them on this, I think it makes a world of a difference for the remainder of their recovery process.
Definitely. The patient education and the prehab is starting to show such difference in a patient's recovery. Just doing the prehab before the surgery, I have seen patients with amazing results post-surgery.
Yeah. And I wish all doctors, surgeons were in line with this approach. Sometimes, I talk to a patient and the doctor suggests surgery right away, or they just say, hey, let's just get your motion back and then you'll be good to go for surgery. I wish they would be a little bit more patient and tell these people, do the rehab first. Spend at least 6 weeks, 8 weeks. Here's the things that I want you to do is get your swelling out of the knee, get your full range of motion back, and then a big key to all this is make your quads as strong as possible. Quads take the biggest hit prior to after surgery, and the stronger we can get them going into surgery, the better and smoother the recovery process is.
Talking about the quads, do you still think that VMO strengthening is really the first and the most important approach in strengthening of the quads?
Do I think what? I missed that. I'm sorry.
VMO strengthening?
VMO. So here's my thing on that. The quads are a big muscle group, right? They're four separate muscles, but they're innervated by the same nerve, right? So I do believe that it's really impossible to just tease out the VMO. For me, it's do the quad work. So there's many ways to strengthen the quad. What you'll learn about me, and if you follow my page, I'm a big believer in isolated quad work, which means that knee extension machine, right? That open chain knee extension. And that's sometimes still a controversial topic today, but this is something that I think people need to utilize after injury, a week after surgery, in some capacity to make sure they're isolating quad work. So that's a staple in all my programs and really stays with all my clients throughout their recovery process.
What about hams and calves and the other ligaments, tendons around it? Do we focus on those as well? We definitely do touch them, but would that be your focus during the rehab period?
Yeah, of course. It's not that it's just all about quad work. There are other muscle groups that we incorporate, such as you said, hamstring, glutes, the soleus, that small calf muscle. These are things that we definitely focus in on. And what I would encourage providers to do is be objective, right? There's still today. It's embarrassing that we're not doing proper strength testing for our patients, for our clients. This should be done on a monthly basis. You need to objectively assess how strong these muscle groups are and the progression, right? And then that should tell you how we program, right? So it doesn't have to be every week, but if you could do a monthly strength test and you have a block of programming and you reevaluate that after that testing period, and then from there you can write your patient's program for them. And what stinks about the traditional model is, if patients are coming to you as a therapist twice a week, they need to have a lot of structure at home. And some therapists are very good about this, right? Providing that material. Some are
Right.
not. So there are patients out there thinking like, oh, I could just show up twice a week and I'll get better. And that's not the case. They need to make sure that they have a lot of that structure outside of their weekly or biweekly visits.
I I I think this when I see my patients, I think they're kids. So you have to treat them like kids. You
Right.
have to give them homework. You have to be. One of my patients said, "You are a PT. This is a PT place." I'm like, "Yeah, what do you mean?" She's like, "It's pain and torture."
Yeah, I've heard that joke before. Of course, yeah,
So
yeah,
I treat them like kids. And yes, home exercises and home education is also such a big key role in any recovery.
yeah.
Uh, with sports specifically for ACLs, do you do anything with the specific sport, like with when you're doing plyometrics and the balance training? Do you focus more? Does your program focus more on the soccer or on the certain sport that they're playing?
Yeah, it really depends on what their goals are. So a big part of what we do here is um, we want to talk to you as a person, and we want to find out what you're looking to get back to, whether that's skiing, soccer, basketball, martial arts, whatever that may be, right? And um, I think it's important, especially at the end care of their rehab process, that it's dictated to that. So the approach is there. But there's so much work from the beginning and the middle and towards the end that needs to be done first. So I think a big part of it is educating your patients that, hey, there are milestones and you don't just get back to your sport in 9 months or 12
Yeah.
months. It's you've reached the first milestone, you pass all the criteria, then you go to the second milestone. And then you pass all this criteria, you go to the third milestone. So again, it's making sure that swelling first, range of motion, strength. Once we establish that foundation, then you can get into more of plyometrics, agilities,
Right.
and then gear towards their sport, towards the end of their recovery process. But I always want patients to understand that you can't just skip steps. Otherwise, you'll be severely disappointed, and you'll also be at a higher risk for re-injury, and we don't want that.
Right. When do you ask the patient to start doing more of home and gym workout? Like that's a transition or a switch between discharge and actually the patient coming in person. Or can we also do the ACL program from home,
Yeah,
from the
yeah.
very
Because of the majority of what we do is remotely, we put the onus on the patient right away. I want the
beginning?
patients to understand that if you want to see a successful recovery process, you need to do the work, and that's 7 days a week. Really, what I share with them, it's about 5-6 hours a week. So every day there's a little something for the knee, and that could be like 10 to 20 minutes of mobility work. And then usually with strength programs that we provide 3 to 4 times a week, it's 45-minute or 60-minute workouts. So that's kind of the sweet spot. And
Yeah.
again, because this is majority remote with our clients, they're doing the work. And what I feel like that does is empowers them, right? It gives them the power to make sure that they're confident in their approach, and what they should be doing every day. They know the goals and they know the work that they need to put in to get there.
Do you not feel the need for manual therapy at the acute phase?
I do think there's a time and place for it, and I'm not against it. I especially in the beginning, patients are apprehensive to move, right? They're scared. Just had a big surgery. I do think having some hands-on care at that period is important, but I also think at the same time it's educating them right away that they can move, and active motion is so important.
Mm-hmm.
So the better that we can educate and show them to get out of that fear, the better it is for them for the long term, because then they can put in the work on their end. So whatever hands-on work you do as a provider, the next time they come in, they'll be so much further past that point. Instead of you do the work, they show up, they take a couple steps back, you do the work again. We never want them to lean on us in that regard. That's just my personal opinion. That show them, make them believe in themselves, and give them the tools to push that progress
Right.
forward.
Since everything is remote, what about fatigue and soreness? You must come across a lot of patients facing that after a heavy workout, especially when they're focused only on the quads, on their lower leg, just because you're not used to do so much leg activity at the gym. So how do you tackle that?
Yes. So the beauty of our program is tailored to the person in front of us, right? So after the assessment that we do, and getting the background and knowledge, some of our people are not, gym rats, right? They don't necessarily love the strength training part of it. So we always have to accommodate in the sense that we want to deliver a program, create a program that you're successful in. So we may start a little bit of less, right? And then see how they respond. What we do is a weekly check-in with our clients. So every week I am able to chat with them and to understand, like, is this at a good level for you? Is this too much? Are you overwhelmed, underwhelmed? And then based on that, we make adjustments. And that's not only just based on the knee. Was there any swelling or pain in the knee? But also, like, how are you doing with this? Is it fitting into your life? Is it super stressful? Are you like getting crazy about this, right? So that's important, because you could provide the best program, and if the patient is unable to do it, right, there's no success. And then
Right.
we look bad, they look bad, and nobody's happy.
Right. Makes 100% sense. Can you tell me a little bit more about what inspired you to just start this whole thing and expand this whole thing?
Yeah, of course. I used to work. Well, let's see. I started my career in 2010, and then we did the residency program. I came back to New York here. I worked in various clinics, and a lot of what I was upset about is I would get overworked and overrun. It was all about numbers. So we would see 20 plus patients a day, and I feel like I wasn't able to really connect with people. I wasn't able to follow through because I felt overwhelmed, and I thought there was a better way for this. And because I had such passion in ACL care and I saw the climate, I wasn't too happy of how insurance companies were dictating, their plan of care. And I would get an ACL client in 3-4 months, the insurance company would
Yeah.
stop their care, and then they would ask me, like, well, what should I do now? And a lot of them were lost. So that's what helped us come up with the idea to start the ACL Academy, which basically is a platform that takes you from A to Z, from right after injury all the way to sport, and we dictate it our way. We don't necessarily work with any insurance providers. So yes, it is an investment for the patient, for the client, but at the same time, they know that they're getting expert level care. It's completely customized to them, and we have their back to guide them to their sport, right? That's their specific goal for recovery. And when we, did this idea of the remote platform, we felt that it was the most cost-effective option and best option to get them exactly where they want to be after surgery.
Right. I can see that. I myself, sometimes I see so many patients. We see 26, 28 patients every day. Every day
Yeah,
with me and my aide. It's just two of us. And I get the fact that you are being overwhelmed, and patients need a one-on-one.
right.
How much ever you're trying your best, but you need a one-on-one. And the insurances here, no. I'm so disappointed with it because I'm fighting every single day to get more visits.
Yeah. It's a battle, and then you're wasting more time on trying to fight for visits, right? And you're wasting more time not being able to be right in front of your patient, listening to them, and being able to help them. So that's what bothered me the most about this. And I know that system has to change, and hopefully one day it will. We never want patients to feel like a number, right? This is a hard process in itself. It's a big surgery. People get very discouraged and they have some doubt. We want to be able to educate them, to encourage them, to support them, and to make sure they know that we also have their back to get them through this process together.
Definitely. That was wonderful. Any last words for our audience out there?
Yeah, no, I appreciate you have me here, and if anybody's interested in ACL care, there's hundreds of thousands of injuries a year, so the patients need the help, and if it's something that you are passionate about, you guys know where to find me. I'm happy to help and to guide and to answer questions. So I really do appreciate you having me on today.
Likewise, I appreciate you being here. Thank you so much. I'm going to leave all your information and I'm going to tag you on this post so people know if they need help with ACL recovery, if they need any help with their knee problems, they know where to come find you.
Thank you so much. I really appreciate you having me on here today.
Thank you. It was a lovely session. Thank you so much. Have a wonderful day.
You too as well. Bye.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.